Joining us right now is Sweta Chakraborty, who's a risk and behavioral specialist. Thanks for being here. Appreciate it. So what can you tell us about these new symptoms that we're learning about?
We know those infected with COVID-19, if they're not asymptomatic, we expect to see symptoms within 2 to 14 days. And those are what we've all heard about now over and over again: fever, shortness of breath, sore throat. A new mild symptom that has some preliminary research around it are foot lesions, and that's been put forward by the International Federation of Podiatrists. Remember, these are still small sample sizes, so until we have more data, we can't really be sure that this is an indicator of the disease versus something unique to the patient. In addition to that, a severe symptom that has preliminary research around it is that of confusion and inability to arouse a patient. And so what we're seeing there is potential that this disease also has some effect on the central nervous system. But it's important to remember this is all very preliminary, and this is still primarily a respiratory illness. And so the real way that doctors triage patients and recognize their priority of treatment is based on how their lungs are functioning. So healthy lungs take 19, 20, 21 breaths a minute. As that increases to mid-20s and, God forbid, early 30s, that's when you know that your lungs are really being strained, and that's when you're experiencing the most severe symptoms of coronavirus. So viewers need to recognize that that is the most important thing to keep an eye out for.
All right, good information. Sweta Chakraborty, thanks for joining us this morning.
I've never actually even thought about 2021 breaths a minute.
Right. All right, thanks for watching MSNBC Live. I'm Lindsay Reiser.
I'm Kenneth Gibson. Up next, Alex